Thank you so much. Good talking with you. There's going to be more coming up right after this.
Thanks, Andy. May is National Trauma Awareness Month, and it also happens to be National EMS Week this week. So we visited Reston Hospital Center to see how the local EMS teams work with major trauma centers to save lives. A life-threatening accident can happen at any moment, and during those crucial times, every second counts. So having a fully staffed trauma center in the area can mean the difference between life and death.
If you take a look at the patients that we serve, trauma is recognized the sooner you can focus resource early on. So you can see this as a room. It allows quick access to things that are life-saving.
Dr. Dennis Wang is the Director of Surgical Critical Care at Reston Hospital Center. He says that bringing patients to his facility saves minutes, costly minutes, from transporting them miles away.
This is why we have trauma centers. So having one at Reston, this will decrease the transport time through a busy street or flying over, let's say, to other regional level 1 trauma centers. So having one allows the local region, northern part of Fairfax County, Reston, that they will have access to care almost immediately.
Nurse practitioner Ruben Perez says the local EMS community now looks to Reston to treat the most severely injured patients. This since the trauma center received its Level 2 designation.
We are capable of taking care of a very serious injured patient. So when you throw that on top, and then after a while, the community and the EMS crews start recognizing that. So we tend to get a good relationship built up after a certain amount of time.
Time is everything for us, especially in a trauma situation. We want to have the patient from the scene to definitive care as quickly as possible.
Firefighters and paramedics like Chris Seaman and Mike Lattimer of Fairfax County know all too well the advantages of having a top-notch trauma center nearby.
So we work with these doctors and nurses day in and day out for every patient that we bring in, so the handoff is very smooth and the patient receives continuous optimal care.
The warm weather brings more activity in the region, along with more accidents.
People are going to be outside swimming, biking, motorcycles, so the chances of having an injury or some sort of a trauma are that much higher. So people should be aware of their surroundings and be aware of these activities and hopefully not end up in a hospital.
Vigilance is key. If you see someone fall or anything like that, definitely stop by, ask them, see if they even need help. And don't hesitate to contact 911 if someone is truly injured.
We can get care for those patients much quicker, and it's really important when you're dealing with some of those major injuries.
And that helps Mary Beth Henry of Sterling Volunteer Rescue with her mission that she says is more like a calling.
I love being a volunteer. It gives me something, a way to give back to the community, and I really enjoy it. It's not for everyone, but I think everybody has a calling, and I feel like this one's mine.
We deal with a lot of falls, vehicle accidents, things of that nature.
Nahal Verk says his volunteer staff is happy to help their neighbors in their time of need.
Community people understand that it's just their own members of the community who are helping them out and sort of responding to their emergencies and things like that. So I think it helps foster a connection between the EMS personnel and the community as well.
What's the relationship like between the trauma center here and the emergency medical services team?
So we have an EMS liaison here, Keith Morrison, who has done a fantastic job with unifying us. We have the utmost respect for each other. We communicate well with each other. They pretty much call ahead and give us a pre-hospital report notifying us that they're bringing us a patient with traumatic injury. We activate the call, and when the paramedics come in, the EMS staff come in and bring us the patient. They don't just drop the patient off. They stay here. They assist us if we need it, depending on the acuity of the patient. So we work really well hand in hand.
Seeing everything from gunshot and stab wounds to major car accident victims, every member of the trauma team has a specific and critical task once a call comes in.
We're a well-oiled machine, so everybody knows what their role is, and whenever we get an overhead trauma call, everyone assumes their position, is ready to go. I guess, yes, we all have a little bit of adrenaline rushes, and that's what pushes us to rapidly work as well as efficiently work to get our trauma patients better.
When they arrive in the emergency room, this means a whole team of doctors, nurses, CT, CAT scanners, laboratory, blood bank, all the necessary components of a resuscitation. If you can focus them early on some very seriously injured patients, we will have better outcome.
For more information about the Trauma Center at Reston Hospital and other services, visit www.restonhospital.com. We'll be right back.
When it comes to carpet, do you know the difference between plush, shag, or Berber?